Welcome back to Live on Lakeside. Time now is 11:38. Well, whether you need home care after an injury or an illness, or you have the loved one that wants to spend the final few days with some special care, well, Robinson Memorial Hospital can help.
Absolutely. And Desiree went out there to learn more about the special services that they offer.
We're at Robinson Memorial Hospital in Ravenna, here to learn a little bit about Robinson's Visiting Nurse and Hospice Care program. With us today, Gail Bentley, Home Care Manager, and Kathy Corman, you are the Hospice Manager. Welcome. Gail, tell us a little bit about what you offer here at Robinson.
We offer 3 programs, and they are providing care and services in the patient's home. Home care provides help for the patient to recover from illness and surgeries, whereas the Palliative Care Plus program actually gives patients that are coping with a life-threatening illness the curative treatments at home. And it really is a seamless bridge to the hospice program. The hospice program actually provides comfort and support to the terminally ill patient and their families, as well as our programs also help facilitate the communication between patients, their families, and the physicians, and other caregivers in the home. And it really provides a positive or improves the patient's quality of life during home care.
Kathy, speaking of hospice, who benefits from hospice?
Anyone who has a terminal illness, and not just the patient, but their family as well. Recently, we were contacted by a family in Manaway who had made a promise to their 83-year-old mom, Peggy, that they would keep her at home until the end of her life. The challenge was that this family is a very busy family. They have 2 teenage sons, very active, and Donna runs a daycare program in her home. But with the help of hospice and all that we're able to offer, they were able to honor that promise to her until the end of her life.
Oh, and Kathy, what type of services did you provide for Peggy?
We developed a plan of care to meet her needs that included a nurse coming to the home to monitor her medications and her comfort level, a home care aide who helped her with her personal care, and a social worker who helped them with the hard, difficult end-of-life decisions that they had to make.
Oh, you've got a big volunteer staff as well.
Volunteers are vital to our program. They provide birthday cakes, hair care service. We have story writers who will write the patient's story, and then they also do memory bears. These are bears that are made out of clothing of the patient and presented to our families in bereavement care.
Oh, that's beautiful. Well, volunteers do play a pivotal role. Also playing a pivotal role here at Robinson's Visiting Nurse and Hospice is Dr. Dieter. Dr. Dieter, what is your role here?
My role really covers 5 areas. The first is to confirm and certify that a patient is indeed terminally ill. Secondly, to provide the overall medical care for the patient while they're in our program. Third is to serve as a liaison between our hospice team and the patient's personal physician. Fourth is to provide support and backup for our hospice team, available 24/7 for medical advice and medication prescribing. And lastly is to continuously educate not only the hospice team but also the medical community about hospice.
Can the patient have their own doctor come on board and help out as well?
Certainly, and we encourage that. The patient and their family are part of the team, and we encourage their own private physician to be part of the team to help us provide this kind of compassionate care.
Tell me what sets Robinson apart from other hospices in the area.
Well, we are a not-for-profit hospice, and we are affiliated with a hospital system which allows access to significant medical resources and allows the patient and family to have a smooth transition as they work through the hospital system, and it's a system that knows who they are.
It takes a special person to work here.
It really does. You know, our team are professionals who are highly trained, certified, and they are here because they are called to do this work, not because it's just the next job opening they found.
You have to have the heart for it. Thank you so much, Dr. Dieter.
You're welcome.
For more information, you can go to robinsonmemorial.org/homecare.
Thank you so much, Desiree. I love the memory bears from the clothing. That's really special.
Very special.
Okay, so temperatures are turning colder. Our skin's getting dry.